Well, my friends, this is once again a case of adenocarcinoma of colon. In short, the colon carcinoma. This is a CA of the colon or rectum. Early cases can be benign and non-cancerous polyp. And at that time, there may not be any symptoms, asymptomatic. But that time it can be detected by screening, by colonoscopy. For this reason, colonoscopy is sometimes essential. Now this is very common. This colorectal CA is very common in the meat eaters, especially the red meat eaters. And that's why I have seen many persons of the Bangladesh coming to me for treatment are colorectal CA cases or C of the ascending colon. The symptomatology depends on the size and location. Our common experience tells the habits of the patient, the changes of the stool consistency, and blood in the stool, and abdominal discomfortness and pain are the four guiding symptoms of colorectal CA. So, we remember the disease mainly found in the meat eaters, especially the fat meat, beef, pork, etc. This gentle lady has been suffered from 64-year gentle lady has been attacked by adenocarcinoma of the colon. She is having residence at Karnataka and has brought to me by this homeopathic physician name, please? Swarup Malik. He is practicing in Karnataka. So this is a very serious and grave disease, a growth of the cells that begins in the part of the large intestine. You know, the colon is the longest part of the large intestine, and it breaks down the foodstuffs for absorption of the body. This colon CA typically affects older adults, though it can happen at any age, at any times, no doubt. But generally, in medical science, we have used the term generally, perhaps, probably, expected, roughly about, more or less, etc. Because there is no hard and fast rule to form a disease, to begin a disease. It usually begins as small clumps of cells called the polyps that form inside the colon. Polyps generally are not cancerous, but some can turn into colon over and time. When it becomes polyp, when it remains as a polyp, it doesn't show any symptom. For this reason, at that time, screening tests may not be required. So, we remember the symptoms are a change in the bowel habit, such as more frequent diarrhea or constipation, occasional or regular or irregular rectal bleeding, that is blood in the stool, ongoing discomfortness in the belly area as the cramping pain, which sometimes mistakes the patient as gas and flatulence, and they usually takes the antacids or anti-flatulent tablets. And this is one of the cause for increasing the disease, development of the disease at times. And uneasiness feeling in the abdomen, weakness, tiredness, loss of weight, and general fatigue, malaise are the common symptoms of this disease. Now this gentle lady requires brimstone, homeopathically, symptomatically, categorically, individually by the collecting of totality of symptoms. Our medicine is brimstone or sulfur. Because the physical makeup, tall cylinder body, the tongue is totally red and clean. Show your tongue.
जबान बताओ सीधा करो जबान को
This tongue, the tongue is totally clean and red. If you go through the cancer laboratory, the mouth discoloration, red, tongue, all symptoms are sulfur. The tip of the sides of the tongue, sulfur red. The tip of the tongue, sulfur red. So redness, red tongue is one of the characteristic symptom of sulfur. This patient having tremendous desire for sweets, which may be called craving for sweets. Isn't it, your mother?
Of course, she is having a lot of risk for the sweets. If she needs to have to eat or something, like just for mango or something, she will like eat like 4 or 5 at a time. And she likes more of only grapes and bananas. Including that, she want to eat food of milk.
So she also prefers milk, sweets, and sweet fruits. Now, the physical makeup, and the patient is very much thirsty,
Yes, of
profuse thirst, copious thirst. So thirsty patient, the tongue symptoms, aversion to bread, desire for milk, and the physical makeup, all other symptoms led me to think of sulfur. So let's prescribe sulfur in 50 millisieverts scale of potencies and let's see the result. In Karnataka, where do you reside?
We have visited several doctors. Example in Gulbarga, there is a diagnostic center. They have been done the colonoscopy for my mom, and they have suggested us that it's a carcinoma, colon, which is in a large intestine. And then we have discussed with our parents and we have discussed with our friends and circles. Then they inform us not to go with the allopathy medicine, better to have a homeopathy or Ayurvedic. Later on, they call us and discuss that we have to cut the large intestine and a small intestine within a large number of 10 centimeter, and they can join, but they are not giving an assurance that it will be cured.
That's
this
correct.
is what we got from information from them.
So, okay. So let's try, my friends. Our prescription is brimstone in 50 millisieverts scale of potencies. So this is the ultrasonic center from the Karnataka. It is written in Kannada language. This is ascending colon region. See the regions of the ascending colon, big tumor, tumorous growth, which was at the earliest stage a little polyp, now converted to big polyp, which is now from benign to malignant. So let's try. I shall report you, my friends, after 3 months about this case. Thank you, Dr. Sarup, for bringing this patient, and I do believe the patient will speedily improve in palliative way.